we mean by the essentials of regulatory affairs. So let us start by talking a little bit about drug development, because I think it's key for individuals in regulatory to understand the drug development process. Really quickly, I'm going to skip through the animations a little bit, but this graphic is just to illustrate to you how complex the drug development process is these days. And it's not so much just the traditional one where you go from non-clinical to clinical anymore, but it's also a lot of parallel design clinical studies. But as this illustration wants to show you is that it takes over 10 years and over $800 million US to develop a compound. And for regulatory, we're actually involved in every step of the development process, because we would provide guidance to the team in development in terms of what would be the expectation of regulatory agencies, so that we will be able to put those data together at the end and be able to submit it and get approval to get a new drug. So understanding the drug development process is very important for us to understand where we fit within the organization. So these slides sort of reflect some of the sessions that we do, the in-person sessions that we do at BSG. We have one-day courses where we go through similar topics, but in more detail. So these are the discussions that we typically would have. I kept them here because I wanted you to have sort of self-reflection, to ask yourself some of these questions when we go through the materials. I think it's good to have rhetorical questions where you can actually think through the topics that we talk about, not just for me to talk to you on the specific issues. So why do I need to know about the drug development process? At what point am I involved in the drug development process as a regulatory affairs professional? Well, suffice it to say, we need to know how drugs are developed so that we know when to support the team, when to provide guidance to the development team in order to meet regulatory expectations. And by doing that, we demonstrate how we add value to the company. So some of the resources, you will see the links in the material, so you can go back at the end and kind of review some of the materials and resource links that I have provided in case you want more information from that perspective. Okay. So let's go into the role of regulatory affairs professional a little bit. What is it? Who are we? Who they are and who are we? So regulatory affairs professionals are integral to the strategic vision of a private healthcare company. Sorry, something is blocking my screen. I just need to move this for a second. Okay. It's integral to the strategic vision of the private healthcare organization. So because the healthcare organization is in one of the most regulated industries in the world, they act as advisors. So regulatory affairs professionals act as advisors. And at the end, what we don't want to be the police of the company. We want to be strategic partners. So that's the takeaway of the role of regulatory. And a successful regulatory professional will provide solutions rather than to criticize plans. So you don't want to go into a business meetings and say, I don't like that. That's not going to fly, right? You want to be the strategic partner. So you want to go in there and provide solutions to help the company navigate around regulatory obstacles. Right? So for example, if you see a proposal like an advertisement that the marketing team is proposing, if you don't think that it's going to be compliant, provide solutions to say, okay, well, instead of saying X, Y, Z, you can say A, B, C, so that you can drive your message across, but also be compliant, right? So this is the mentality that we want to have, and I wanted to frame this before we dig into the details, because I think the mindset of being a regulatory affairs professional is as important as having the technical background. So that's very important, I think, going into the careers of regulatory. So what do? We don't just file submissions and get things approved. We provide strategies to navigate around hurdles in order to get things approved in the shortest time and the optimum label. There's no point to get something approved. It's going to take like 5 years because you're not going to be competitive enough. On the other hand, there's no point to get something approved very quickly, but not with a label that your commercial colleagues will be able to market. So all those components would be equally important to something to think about. So how many levels, hypothetically speaking, are there in regulatory? Well, you know, you always have the assistant level where you maintain documents, submissions. You have the coordinator level where you provide administrative support, renewing licenses. The bulk of a lot of people in regulatory would be at the associate level, where you actually manage multiple stakeholders within the company. You file submissions to agencies, you maintain product compliance. And then you go into the management aspect. So I'm not going to go into a little bit of too much details, but just to touch upon that, typically people have a science degree in regulatory. Advanced degree in research would help, especially when you're into development, talking about clinical design, talking about CMC and things like that. For people in management, an MBA would also support and help and to facilitate your career growth as well.